Hi, this is Haley Hopper. I'm the lead preceptor for physical therapy at AW Healthcare. Today I'm showing you basic CanTime navigation for therapy. Here is your home page. When you log into CanTime, or if you click this home button here, this is the page you will get. On this page, it looks like there's a lot going on, but there's only a couple things you'll need. The first is your office communication or your inbox. This is where you'll receive any messages or care coordination notes that were sent directly to you. And when we get to care coordination notes later, if you send a care coordination note and notify staff, it will show up on their inbox here. You may also need to use this schedules box. Here will be your pending visit notes. This is how many notes are pending as of this date. The blue box is the total number of notes that are pending, and the red number here is if there are any that are overdue. You may also need your confirmed schedules or unconfirmed schedules for this week and next week. So if you click on these, it'll show you what patients are on those weeks as of this time. And you will want to click this blue box, and then you'll have an option to confirm that schedule. Okay, so from here, there are a couple places you may want to go. The first is to see your weekly schedule. You'll go to Schedule, Clinician Weekly Schedule, and it'll bring you to a box that looks like this, or a page that looks like this. So here would be an example of a weekly schedule. You'll see a couple different colors of notes here. Blue means it is a note that hasn't been started yet. Green means it's a note that's been completed. If it's pink, that means it's in progress. So it's been opened, but it hasn't been completed. The orange is a miscellaneous visit. So when you start a week, most of your visits will be blue. And as you complete your notes and go along, they'll eventually all be green. Okay, you can click and drag visits from day to day as long as it's allowed. You might get an alert that says you can't do that for whatever reason. For example, an evaluation can't be moved outside of the 5-day window from the start of care. If it's going to be done outside that 5-day window, you'll need to get a verbal order from the physician's office. And you can't move visits outside of the week. So I'll try to click and drag this one. And it did let me move it. Okay. So another tab you might use is timesheet. This is to find your daily timesheet. So clinician daily timesheet. And that'll bring you to a timesheet that looks like this. This particular day, there's only one patient on. This is also probably the easiest place to start a note, or one of the many ways you can get to a note. But you would click eChart, and that will start the note. This is also the best place to get to the patient's chart by clicking the client's name. You could also access the patient from client list, but it seems to always take longer that way than to just go to the timesheet. Okay, this is the main profile for this patient. On the profile, you will see the case manager. You will see basic information about the patient. If you scroll further down, their physician name and contact information will be listed in case you have to call the doctor for orders or to report any incidents. If you scroll down a little further, if the patient has emergency contacts, those will be listed down here. Okay. And then from there, you won't really need to use all of these tabs, so I'm going to show you the ones that you'll probably need the most. The next one here under Still Profile, we're going to go over to Documents. This will be where you'll find any hospital discharge notes or face-to-face notes. This is also where you will add a new document and you'll upload your Inter-Rater form or the functional assessment score form that you'll need to do with an evaluation. From here, you may also want to use intake information. This is just kind of a variety of information from the chart, so it'll also have information on authorization, basic patient information. Down here at the bottom, I like to review this for their past medical history. It'll usually be listed down here. Their primary diagnosis. Of course, check with the patient, talk with the patient, make sure that's accurate. But it's a nice place to review. Okay, and now we'll move on to episode. This will give you all the information about the patient's episode, starting at the top, their certification period, again, their case manager. This will be the calendar of all the patient's visits from all the different disciplines. You can change the parameters over here if you want to see just one discipline. And then there'll be all their notes. This is another way you can access the patient's visit note. So again, over here, you can click eChart and it'll start the note for you. Same color code. Blue is not opened yet, pink is in progress, and green is completed. Now this one's kind of confusing because it's blue here and green here. What that means is I have put a timeout in, but I haven't saved and submitted the note. We advise you not to put a timeout in a note unless you've submitted the note. Down at the bottom, you'll be able to see any forms that have been submitted for this patient across all disciplines. So each visit, you'll need to fill out a COVID screen and a Wong-Baker pain assessment. You may also find outcome measures in this area if you want to review those. One of the most important things on this page is that care coordination section. So if you click here, this is basically our communication hub for this patient. So this is where we will put any information in here, for example, patient's vital signs were such outside of parameters, the physician was notified, no changes made, just kind of basic updates. There will also, in most of the notes, be a care coordination box at the bottom. And those notes will go here as well. So you don't need to put a note in there and on this main episode page. But if you do want another clinician to be notified of something immediately, you'd want to do it through the episode tab here because you'd want to add a note, save, notify staff. So within the visit notes, it doesn't give you an option to notify staff, but through the episode tab it does. I'm going to notify Lindsay. It'll make it a message. You can add other recipients by clicking here if you want to, and send. Okay. Now the care coordination notes, that's where you're also going to want to put your summary and your requested frequency after an evaluation. Okay. All right, other tabs you may want to use, this authorization tab. Until you get familiar with the different insurance companies, it's a good idea to check the authorization tab with every evaluation to know if you will need to request additional authorization. So if the insurance does not require authorization, you can come here and it'll say no authorization needed. And then if you are doing an evaluation, for example, and you need to request your frequency, you can just put that in that care coordination note back in the episode tab. However, if they do have authorization, this is what it'll look like. So this patient has 4 visits. If 4 visits is enough and you don't think you need any more, you can just, again, go to the episode tab, care coordination note, and enter your frequency request. But if you do need more visits, you'll need to add a new authorization request. So you'll click here, add a new request. Okay. Then for me, I'm going to just select PT. Make sure your date parameters are correct. I'm going to ask for 2 more visits. Continue. Okay. You'll need to upload a managed care assessment form by adding that document here, and then you will save it. And then that will show up down here. Okay. Some other tabs you may use. You may also want to review the patient's medications. If a patient has a medication change during any of the visits, whether it's an eval or a visit, that will need to be added to the medication list. You can add that through orders, which we'll have another video on how to enter orders later. You may also want to check the patient's care plan. This will show you any and all goals across disciplines, interventions. If you need to make any changes to the goals, that will also be an order, which we'll do that in another tab or another video. This is the orders tab. If you need to add any, again, new orders here, and that's for anything from a medication change, a change in the goal, a frequency change, and again, we will cover that in another video. Okay, and from there, if you click the home button, it'll just take you back home. And those are the main tabs and main parts of CanTime that you will need to use for your visits for home health.